Good morning, everybody. This is Kavita here, and I am a PhD research scholar student in Texila American University. So, my presentation is of the paper that is related to correlation of anxiety and depression with quality of life of cancer patients during chemotherapy or radiotherapy. Now, coming on to the introduction of the subject, as we all are aware that cancer is a generic term for a large group of chronic diseases that is known to be pathologically characterized by abnormal rapid growth of the abnormal cells, thereby it affects any part of the human body of both genders and thus have become a major cause of mortality and morbidity worldwide. Now, coming on to my research study, the study which I carried on was non-interventional, prospective, observational, and descriptive type of pilot study. The major primary objective was to analyze the association of anxiety and depression levels and their impacting factors on the quality of life in homogeneous surviving cancer patients that either receive chemotherapy or the radiotherapy sessions. The methods included in my study was the usage of the three quality life questionnaires that were used on the 30 patients that underwent chemotherapy sessions and 30 patients who underwent radiotherapy sessions. Results of my study was chemotherapy group patients were more affected due to anxiety and depression as compared to the radiotherapy group patients. The conclusion was that WHO QOL brief questionnaire, the Zoom self-anxiety rate scale, and Zoom self-rating depression scale could be used as a predictor of anxiety and depression during chemotherapy or radiotherapy sessions for the cancer patients. So the overall interpretation of my study was depression can be defined as living in the past and anxiety can be defined as tension about the future. Therefore, quality of life of the cancer patient is heavily impacted due to anxiety and depression. Now, coming on to the importance and relevance of the study, there is no gold standard for measuring the quality of life in cancer patients because no one instrument would be appropriate for all the situations. Thus, the present three quality life questionnaires could help in debriefing the levels of anxiety and depression during the chemotherapy or the radiotherapy sessions. The proposed study was considered valuable since it emphasized on quality of life as one of the possible outcomes during cancer treatment that stressed on the significant factor of anxiety and depression during the chemotherapy or the radiotherapy sessions. Now, coming on to my problem statement, the major problem that I stated before this conduction of my study was that which domain in the WHO QOL brief version of the questionnaire was the most frequent and most affected by the specific factors by using the questionnaires of Zoom self-rating anxiety scale and Zoom self-rating depression scale. And what was the mean level of quality of life and anxiety and depression in patients with cancer during chemotherapy or the radiotherapy sessions? Now, the background of my study was I enrolled 60 patients for the conduction of my study. And for this, I approached the research site for my study was Dr. B.L. Kapoor Memorial Hospital in New Delhi, India. And for this, I received the ethical consent from the ethical as well as IRB approval from the hospital committee. Now, after having the ethical approval from the hospital, I approached the health professionals there, and then I contacted the medical oncology department where I recruited the chemotherapy patients, and to the radiation oncology department where I recruited and approached the radio treatment patients. Now, after that, I conducted my study and reached my eligible patients. That was the target 30 for chemotherapy sessions and 30 for radiotherapy sessions. After that, the data analysis was performed and the anxiety rate was assessed by using the Zoom self-rating anxiety scale. And then depression was assessed through this questionnaire that was through Zoom self-rating anxiety depression scale. And the overall assessment of the quality of life of the cancer patients undergoing both the treatments was carried out by using the questionnaire WHO QOL brief scale. Now coming on to the method, the data collection method. The treatment-related symptoms were assessed by using a series of interviews through standard questionnaires of WHO QOL brief that consisted of 26 questions. and was followed by Zung Self-Rating Anxiety Scale consisting of 20 questions and Zung Self-Rating Depression Scale that also consisted of 20 questions. The inclusion criteria for the participation were patients aged 18 years or older, cancer diagnosis confirmed by biopsy or FNAC, undergoing the treatment and voluntarily agreed to join the study. The statistical analysis was carried out by using the SPSS version 17 software, and the statistical methods used were pair t-test, students t-test, Pearson correlation coefficient test, and the Pearson chi-square test. A p-value less than 0.05 was considered as statistical significant. Now, the results of my study was the mean age of the patients that underwent chemotherapy were 54.37 and the mean age of the patients undergoing radiotherapy was 54.21. Now, the Cronbach's alpha coefficient was utilized to check the reliability of the instrument tools that I used in my study. And for WHO QOL BREF, it was measured is equal to 0.672. For Zoom self-rating anxiety scale, it was 0.742, and for Zoom self-rating depression scale, it was 0.522. The mean scores of anxiety and depression in the chemotherapy group was found to be 66.62 and 58.66 respectively. And the mean scores for anxiety and depression in the radiotherapy group was found to be 53.95 and 52.12 respectively. Anxiety affected the physical domain, environmental domain in the chemotherapy group, and social domain in the radiotherapy group. On the other hand, the depression level affected the social domain in the chemotherapy group and the social domain in the radiotherapy group. All the values were significantly correlated with the quality of life of the cancer patients, and the p-value was less than 0.05. Coming on to the discussion, the hypothesis stated was the null hypothesis, according to which it was expected that socio-demographic variables, clinical characteristics, anxiety and depression levels did not have a significant impact or correlation on domains of quality of life of cancer patients during chemotherapy or the radiotherapy sessions. But according to the alternative hypothesis, it was expected that socio-demographic variables and the clinical characteristics, anxiety and depression levels did have a significant impact or correlation on the domains of quality of life of the cancer patients during chemotherapy or the radiotherapy session. Now, the alternative hypothesis was further characterized, sub-characterized into the first positive domain that, according to which it was expected that the socio-demographic variables, the clinical characteristics, anxiety and depression levels had a significant positive impact on the domains of quality of life of the cancer patients. However, on the other hand, according to the second alternative hypothesis, it was expected that the variables anxiety and depression levels had a significant negative impact on the domains of quality of life of the cancer patients during chemotherapy or the radiotherapy sessions. So, while interpreting the results of my study, it was found that 20% were males and 80% were females in the chemotherapy group, and 50% were males and 50% were females in the radiotherapy group. Majority of the patients, that were 53.34%, were in the age range of 46 to 60 years. And according to my study, the null hypothesis was rejected and the alternative hypothesis was accepted. Therefore, anxiety and depression levels had a significant negative impact on the domains of the quality of life of the cancer patients during chemotherapy or the radiotherapy treatment, which further shows that as the anxiety or the depression level increases, on the other hand, the quality of life of the cancer patients decreases on the other hand. Coming on to the conclusion, the results suggested that the WHO QOL breath questionnaire, Zung self-rating anxiety scale questionnaire, and Zung self-rating depression scale could be used as a reliable predictor of association on correlation of anxiety and depression with that of the quality of life in the cancer patients. Patients on chemotherapy were found to be more badly affected in some domains of quality of life as compared to those on the radiotherapy sessions. The study showed that the increase in anxiety or depression levels subsequently reduced or decreased the quality of life of the cancer patients either undergoing chemotherapy or the radiotherapy treatment. Now, coming on to the future steps that could be included, that the prospective longitudinal multi-center study with large sample size is recommended. Strong participation of non-governmental organizations and care groups to cope up with the disease for long-term cancer survivors is required. The psycho-oncology clinic should be made functional at every hospital for the needy cancer patients and to investigate the usefulness and the feasibility of the quality life questionnaires that has been used in the study for the further intervention. Now, this was all about my presentation that I could sum it up in a very brief manner. And anybody is having any query regarding my research study are invited to please participate. Thank you.